Hello everybody, and welcome to Lecture 1 from Module 121. This is the video that continues where we were yesterday, and I will be doing 2 video lectures at least, and you can start with this one. You'll notice that the slides do not look exactly like the ones that you have in your module. I will post these on the Facebook page as well so that you can download them if you want to have the printed copy to follow along with. But the content is pretty much the same. I've just formatted it a bit so it's more easy to follow along with as part of a video lecture. Let me apologize for the sound quality here. I don't have my microphone working properly, so I'm using the one that's built into the computer, and that's a little less effective, but I think it works clearly. I also wanted to let you know what you should have as you're working through the video lecture. You'll definitely want a pen and paper, and you'll want to take notes just as you would with a classroom lecture, and it's a good idea to pause to do that when you need to and rewind if necessary. It's a great idea to do this with a partner, even if you're using an electronic form like your phone or the Facebook page to follow along with the lecture and talk with people. And you'll also want to have your textbooks available. You'll need the Green Competencies book most of all, and that one will particularly be focused on Chapter 9. You'll also want to have your purple Understanding the Purpose of Challenging Behavior and your psychology dictionary at hand. So we spoke a little bit about this on the last class, and I just want to start with going back a little bit to what we talked about there to make sure it's entirely clear. This video will lecture about what are the specific approaches we might bring to bear once we have understood why a person's behavior is happening. The functional assessment would let us know what was going on, and we would then start to think about what we would do. Now, for this video and for this module, we're going to focus particularly on 3 types of procedures: medical and health interventions, skills and knowledge interventions, and those that are focused on the motivations of the person. Let's go up to the medical and health ones here. These are strategies that would address the overall health of the person, just making them healthy in general, or that might address issues, for example, of pain, injury, disease, or mental health diagnoses, and those would be mental health issues or physical issues that were part of or entirely explaining a person's behavior problem. An example might be a person who has diabetes. If you know about diabetes, you know that it means that people often have low blood sugar, and you know that when people have low blood sugar, they often are really cranky or miserable. They have difficulty controlling their emotions. The fancy term for that is emotional dysregulation. If a person's behavior was happening as a result of diabetes, then it would be really fundamental for us to help to treat that diabetes, and we would do that with a whole host of things that were medical and health related. Those would include things like diet, exercise, making sure they took their medicines, and monitoring their blood sugar. We also understand the importance of psychosocial things. So, for example, if a person had a mental health issue, something like exercise, socializing with other people, getting outdoors might help them with a medical diagnosis in the mental health area like depression. So they're not always a physical response to a physical problem. Sometimes things like socialization and exposure to light might be a part of what we're doing. The next area is one we spent some time focused on in a recent module on life skills training. So you've learned quite a few of those tools, and these are tools that are used to address issues where a behavior is caused because a person cannot do what needs to be done in that social circumstance, or they don't know that they're supposed to do it. An example of this might be a person who has a lack of sociosexual skills. So because they don't know the rules of sociosexual behavior, maybe they touch themselves sexually when other people are around, or they touch other people sexually and cross those boundaries because they don't understand how to behave. How would you intervene in that circumstance? Well, you might engage that person in sex education classes. You might buy books for them or computer programs that are instructive and help them to learn those rules in the privacy of their own home. They might participate in daily discussion sessions with the staff or a therapist. They might participate in role plays where they actually go back and review real life situations and see what could happen if they did a different behavior. And you might actually give them feedback in a naturalized setting. You're out in the community with the person and they're behaving in a way that tells you they're sexually attracted to somebody, and so you might give them feedback on how they might behave in that naturalized session. So naturalized just means working with that person to learn those skills in a real life setting. But the one we want to focus on the most today are these ones here, the motivational strategies. These are strategies that would be used to address issues where the person was motivated by some sort of reinforcer. They might be reinforced by something like attention, power, revenge, feelings of inadequacy and wanting to avoid. But they might equally be motivated by something like physical pleasure or amusement. Maybe something is funny to them. Maybe it makes them feel relaxed. Maybe it makes them feel sexually stimulated. So when that happens, we want to use strategies that help a person to get their reward in a more functional way. We don't try to change the reward. We try to change the skill they use to get it. And we do that by really amping up the reward for the new behavior, which we call the desired behavior, and by trying to draw down the reward the person gets for the troublesome behavior, the behavior that's currently occurring. So an example might be a student yells out in class to get attention. That's the troublesome behavior. So our intervention would be to reward him for putting his hand up in class. That's the behavior we want him to do, the desired behavior, or DB. And we might make sure that we have a rule where we simply do not respond at all when he yells out, so that that behavior is met with what we call extinction, or a complete lack of reward. And by trying this approach over time, he'd start to realize that the hand-raising behavior is much more functional or effective than the yelling out behavior, and that would gradually cause him to change his behavior. Now, in a later module, much later in the year, we're going to add some other techniques, things that we do to the environment, things we might do to the communication we have with people, and the way that we organize activities and schedules are also important. But we're not going to focus on that here. We're going to focus on the three I've already highlighted. Remember that whenever we come up with the interventions or service actions that we use for people, we do it by assessing first. It's not a guess. It's not just a checklist. We want to make sure that we size up the problem and understand what the needs of the person are, because that's what will dictate the interventions we choose. So we call that an assess and address approach. But I want to remind you that even after we've applied those interventions, we're going to go back and continuously assess to make sure that we were right and that we're using those interventions in the most effective way possible. It's very common that we'll need to adjust and adapt. So people often have multiple assessed needs, and it's really important to understand that we're not looking to simply find the single cause and the single intervention. It's very common for people to have multiple needs, and we usually need to combine those approaches. We've already learned about this. We called it a psychosocial rehabilitation approach, or a holistic approach, a comprehensive approach, the medicine wheel approach. They're all the same thing. All we're saying is we want to address all of the areas in which a person might have needs at the same time, or else we won't be very effective. If a person has a health-related cause for their behavior, then of course we're going to apply medical interventions, including those that are psychosocial. It's not always medicine and surgery. Sometimes things that don't look medical can pay off in terms of our physical and mental health. The classic example of this is that we know that people who exercise and socialize are less likely to have depression. When an issue is about skills and knowledge, we use the training and teaching skills that we've already learned before. But a reminder, we don't do those things on their own. We need to reward people for participating in the learning program and for progressing as they get gradually better. And then the part we want to focus on the most today, motivational strategies. Those strategies are sometimes called behavioral strategies because it refers all the way back to the learning we did about operant conditioning, guys like Skinner and Watson, who came up with this idea of behaviorism. And what they meant by that is we do things because we're trying to get rewarded and we're trying to avoid negative or unpleasant consequences. And that was called operant conditioning. And you might even remember another guy by the name of Ivan Pavlov, and he was a behaviorist as well. He was the guy with the famous experiment using a dog, and what he did is he associated the sound of a bell with the delivery of food, and that created a behavioral response by the dog. That's called classical conditioning, and it's also behaviorism. And we're going to do a lot less with that in this particular module, but we'll add it in later on, and we'll get into more detail later on. So take a moment, pause, and if you have a partner, Think about whether or not you can think of any examples of techniques you've learned in each area. And you might think to yourself, well, the skills and knowledge one I'm pretty good at because I just finished that module. I don't know any health strategies, you might think. Well, the health strategies that we would apply with the individuals we support are the exact same health strategies that you would be familiar with in your own lives. What are the things that you do to promote your general health, and what sorts of things might a doctor or other medical professional advise you to do if you were sick? Be careful here. Don't write down go to the doctor as an intervention. Going to the doctor doesn't make us healthy. It's usually the assessment part of a healthcare program. And what we normally want to do is write down what we would do after we left the doctor's office. What prescriptions did the doctor give to us? What advice did the doctor give to us? Now, you don't need to get into specific medicines here, but medicines would be an example of an intervention we should list under the medical area. And you might say, I don't know any motivational techniques yet. You do know some. We'll get into more, but put down the ones that you recall from our earlier modules and from your reading in Chapter 9 and in the other books. So pause and take a moment to do that in those 3 columns. Okay, we're back, and let's see whether or not you did okay in the first 2 categories. Did you identify things like medications, exercise, adapted equipment, such as, for example, a wheelchair, or something like, for example, one of those devices that helps people with sleep apnea sleep properly through the night. Perfect example of a piece of equipment that would help with behavior, because of course if you're not sleeping well, you're probably going to have difficulty managing your behavior the next day, and this piece of equipment is going to help you to sleep and therefore would help you to behave better. Maybe you need to work on your sleep hygiene in general. That means the habits we have about going to bed, sleeping in a position or in a comfortable setting, nutrition and diet, pet therapy, and maybe you talked about other types of therapies here like music therapy or art therapy. They would also fit here. Occupational therapy. Remember, these are people who help us to restore our day-to-day functioning. They might do adaptive equipment for that, or help us to strengthen skills like our fine motor skills or our gross motor skills. Psychotherapy. This is things like counseling or a psychiatrist sitting and working through our problems with us. Massage and physiotherapy. Psychosocial rehabilitation programs. Now this might be something like residential recovery programs for people with drug and alcohol addiction, or maybe an eating disorder. A lot of times these programs try to combine all of the things we have here plus some of the things in the next couple of slides, and they're basically a setting where a person goes and is immersed because they're getting a lot of these things all at the same time. Chiropractors, surgery, dental care, prevention and safety things. You probably didn't think about this, but simple work that you might do, such as teaching somebody safety skills or fire inspections around their home, are ways that we're going to keep people healthy. Teaching people how to have hygiene or managing people's hygiene, obviously important in preventing illness and creating feelings of physical comfort. First aid is important, obviously. Birth control. Now, birth control is not only a medical intervention that helps to make sure people don't get pregnant, but it actually ends up having a whole bunch of other effects because they're hormones, and hormones can affect our moods, they can affect our feelings of comfort, they can even affect things like acne, and all of those things might later on have a downstream effect on our behavior. And hydration, something as simple as drinking water, might help us to feel better and therefore might affect our behavior. There's lots of stuff I didn't say here that might be on your list, and that's totally fine. What did you put under the skills and knowledge interventions? Many of these are things we've just covered. Things like modeling, task analysis. I realize I've got task analysis down here twice. Forgive me for that. Social stories. Now, we haven't talked about those yet, but I'd strongly recommend you do a quick Google of that and see what they are. A very useful tool. AAC is augmentative communication, and you're doing a paper on that right now. Media, things like books, software, and games that are used to teach people. School-based courses. Signing up to go to school is part of how we might intervene. Scaffolding, which is a fancy way of saying having peers teach younger kids or kids who are less experienced. Adapting equipment, processes, educational materials, the environment, so that people can learn to be independent. We talked about task analysis already. Successive approximation and shaping, and chaining are both techniques we learned that come from task analysis. Simple rehearsal, practicing something over and over again, or role-playing social situations. Naturalized teaching, there it is again, the idea of helping a person to learn in real life, stopping and debriefing or preparing for real-life situations. Prompting and cueing are techniques we learned for teaching, so was hand over hand. And 3D, which is not something we've talked about yet, simply means demonstrating for people, then describing, then doing the activity with them in a series, in that series. And we'll talk more about that in a module we start in February. Best practice praise we've talked about in detail. And we've also talked about educational corrections, which means basically giving a positive contingency statement to somebody if they've made a mistake so that they use it next time. So we would simply say to the person, if you do blank, you'll get blank next time. And this would follow them making a mistake. Moving on, let's talk about proactive and reactive strategies. We've covered this before, but it works. It's worthwhile, I should say, to review it and make sure we're completely clear. So all of the techniques we'll use, or interventions we'll use when we're dealing with behavior, are either going to be proactive or reactive. In fact, some techniques, and we'll learn this later, are able to be used either way. It's important to understand that proactive and reactive strategies are both necessary, and they're both good. Sometimes people think the word reactive is a negatively connoted word, has some kind of bad connotation. But here we mean both things are needed. Proactive strategies are strategies that change behavior gradually, and they do that using positive approaches. What do we mean by positive? What we mean is they do things that are good instead of focusing on punishment or consequences. They address the needs of the individual. Proactive strategies are focused on the desired behavior, the DB. Some examples of proactive strategies are strategies that reward the person for using the desired behavior, or that teach the desired behavior, or that address underlying mental health needs. All of those things would be constructive processes that would gradually see the person using the desired behavior more and more often. And that's what makes them proactive. But of course, we know that people don't change overnight. We know that a behavior is going to take some time to change, which means that we can expect to see the troublesome behavior from time to time, even if our program is successful. Now, hopefully, we'll start to see the troublesome behavior less and less often. But unless we have a plan, sometimes the things that we do when the person exhibits that troublesome behavior actually cause such a disruption to our relationships, or they undermine what we're doing proactively, that they cause any progress we were making to be lost. Sometimes things even get worse, not just not get forward, but they can actually be the cause of frustration and a feeling of failure that can actually be destructive. So reactive strategies are important because what we're doing is we're planning ahead and coming up with strategies for managing problem behavior until it improves. And remember, that's the TB. So reactive strategies are focused on that troublesome behavior. They get put in place when the person does the thing we don't want to see. These must also be positive strategies. That might sound like a bit of a contradiction. What do we mean by positive? We mean that we're focused on the thing we want to see. We're focused on rewarding behavior that we want to see and making sure that everything we're doing is about making the program as functional for the client as possible. We don't want to use strategies that can undermine our proactive strategies. We don't want to do anything that might break a relationship up with the person, create feelings of anger, resentment, or low self-esteem. And we don't want to do anything that might inadvertently reinforce the very behavior we're trying to get rid of. In other words, we don't want to accidentally strengthen that problem behavior. What are some examples of reactive strategies? Well, let's say a person has a medicine. We call this a PRN medicine, which means a medicine that's taken as needed. Let's pretend a person has a medicine that they take when they're really agitated. So we might help that person to take their medicine at that point to reduce their feeling of anxiety or anger, and that would minimize the problem behavior. Another example of a reactive strategy is called redirection. It's a fancy way of saying we might remind the person to use the desired behavior. So if a person, for example, was eating with their fingers and that was the problem behavior, we might gently remind the person to use their fork, and that's an example of redirection. Now, neither of those are terribly sophisticated. We're going to add to the list of these reactive strategies as we go through this module and later modules. Most of what we're learning so far starts us off with understanding proactive strategies. So what I want to ask you to do is go back to the list you just created of previous interventions and see whether or not you can identify proactive interventions from that list. And I know we haven't got to the list of reinforcement or motivational strategies yet. We're going to do that in just a moment. So pause and see if you can come up with an identifiable list of proactive interventions.